You're watching Fox 10 Arizona Morning with Ron Hoon, Rick D'Amico, Andrea Robinson, Kristen Anderson, and Corey McCloskey in HD. Coming up.
All right, welcome back to the Health Wire. Women are urged, we've been told, to get regular mammograms by the age of 40, starting at the age of 40 at least, unless you have some family history.
Yeah, well, and that's always something to consider too. But a brand new study says too many women who are diagnosed with breast cancer are being overtreated. Now, what does this mean, overtreatment? Alexis Vance is with a breast cancer specialist to explain. Alexis?
Good morning, you two. Breast cancer, pink ribbon, we all associate the two. And how many times have you heard, get your mammograms because the earlier you catch breast cancer, the better? Well, a new study out of Norway shows something a little bit different. I'm going to bring in Dr. Robert Kuske with Arizona breast cancer specialist to weigh in on this. So tell us about this study. It's interesting.
It's a study out of Norway that looked at the impact of mammography on detecting cancers, and it found that many of the tiny cancers that we discover as mammography gets better and better and better may not be life-threatening, may not blossom into something that's going to cost a woman her life.
So they're saying some of these tumors can even go untreated because they won't affect you at all. But here's the thing, who's going to look at a tumor in their breast and leave it untreated? It's too scary.
None of my patients will, that's for sure. And the problem is picking out which of those patients have very benign, not very aggressive cancers. And we do have some tests right now available that we can pick out aggressive tumors and separate them from non-aggressive. And we have lesser treatments for those patients. We customize the treatment for each patient, and less aggressive tumors get less aggressive treatment, less chemotherapy, and only 5 days of radiation instead of 6.5 weeks.
But you've said you've seen tiny little tumors grow, so you can't leave these untreated. You have to do something.
That's the scary part, that sometimes mammography picks up a pea-sized tumor that a year later has spread through the woman's body. And we still need to find these cancers earlier and earlier and earlier. That's the negative of this study, is if it makes women not want to get mammography.
So you're still saying, study's great, maybe we can use it in the future, but still get your mammograms, age 40?
From age 40 and on, we recommend annual mammogram. If you have a positive family history or a genetic test, then we move that up. But mammography is still good. We're detecting earlier and earlier cancers, better survival, and less mastectomies.
Yeah, you want the least invasive treatment when you're dealing with chemo and radiation and surgery, because it can really take over your life.
You know, these tests, like the Norway study, may pick out patients that need less aggressive treatments, and we can customize the treatment for the disease.
Okay, well, Dr. Robert Kuske, you're so good as always. Thank you so much. So, an interesting study, you guys, but I don't think it's really going to change the way breast cancer is treated quite yet.
Boy, thanks, Alexis.
All right, wow, interesting.
There's always something to think about.
And then you wonder, if you do leave something untreated because you don't necessarily think it would become anything, what if it does?
Yeah,
I mean, how can you be so sure that it wouldn't?
Kind of err on the side of
caution. Yeah, exactly.